In this episode of At the Vets, Asha is having breathing difficulties.
The airway will collapse. There is a possibility the dog might die.
2 might be better than 1.
It's a beautiful patient. That's one of the reasons why the owners want to clone them.
And Reeza needs life-saving surgery.
If those intestines get strangulated, it could potentially be fatal for Reeza if it's not fixed.
And with pet ownership on the rise, vets in Singapore are busier than ever. But in recent years, a spotlight has been cast on the mental health challenges faced by vets.
We have too many vets who get depressed. We have too many vets leaving the profession, going to some other profession. And that is a tragedy.
For 3 months, On the Red Dot enters the clinics of some of Singapore's busiest vets for a rare glimpse at the vets. Gentle Oak Vet Clinic at Ghim Moh.
I'm the founder for this group called Voices for Animal. We actually rescue, rehabilitate and rehab animals. The girl, Reeza, R-E-E-Z-A. Reeza happened to be from one of the pet owners that could no longer care for her, so they contacted us and asked if we could take over the dog.
Attending to Reeza is Dr. Lee Yi Lin, the owner of the clinic. Dr. Lee has worked with Voices for Animals for 6 years and treats their rescues at a discounted rate.
So somebody just gave up this girl.
Okay.
We noticed that she has this growth in her.
How old is she?
I think the owner told us about 7.
Is she sterilized?
Not yet.
Not yet. I think what she has is possibly a very, very big inguinal hernia. We do feel that little lump. Actually, it's not little. Comparatively to her size, it's pretty large. It's huge, huh?
An inguinal hernia happens when abdominal contents protrude through a tear in the muscle wall. An untreated hernia could cause Reeza a great amount of pain.
Not something like cancer or whatsoever.
No, hopefully not.
Okay.
Hopefully not. What we're gonna do is probably just take an X-ray to have a look. Alrighty. Okay, baby girl, you come with us, okay? No. This girl is stressed for sure, very worried. So first steps now, I'm just gonna get a X-ray done. Just to make sure the areas are just a hernia and not a mass or a tumor. That's what we're concerned about. But we'll see, we'll see. Oh, she's shaking like a leaf. It's okay. Come. I'll show you the X-rays.
Something we should be worried.
No lah. So that's the area where the hernia is. You see all these little black loops there? Those are actually loops of intestines right there that has herniated out lah. I think Reeza might have been used potentially as a breeding dog. The fact that she's not sterilized, the fact that she has a huge inguinal hernia that has just gone non-treated in female dogs and used as breeding dogs, that muscle layer seems to be always a lot weaker. I think we definitely need to get the surgery planned out for her soon.
Okay.
It's quite a big hernia there. That hernia itself is almost, I would say, 20% the entire dog size. And what is more dangerous for her is because we have loops of intestines actually in that hernia. If those intestines get strangulated, if they twist upon themselves, and if it basically starts to die off, it could potentially be fatal for Reeza if it's not fixed. All right. So we'll just plan for the surgery.
Okay.
But usually with this, typically what we do, we'll get her sterilized at the same time.
Okay.
And then possibly we'll repair up the hernia itself.
Reeza will return in 1 week for surgery with Dr. Lee.
Okay?
Thank you, Doc. Thanks so much.
No problem. We set this clinic up in 2015. How long I've been doing this work? So it's been 17 years going to 18, thereabouts.
Hello, handsome.
The reason why I want to be a vet I guess my true ambition was really to try and go into wildlife conservation. Working in a safari and all that stuff, of course that's not gonna be what real life is. But you know, going through vet school, turns out small animal medicine was something that definitely resonated a lot with me, which thankfully I'm blessed enough to have been able to do so.
Meanwhile, at the Advanced Vet Care Veterinary Centre, 1.5-year-old Shih Tzu-Bulldog mix, Asha, has been having difficulty breathing.
Hello. Oh yeah, your nose is a bit narrowed. There's no airway at all, it's totally occluded. One of my colleagues actually saw Asher a few weeks ago and they identified that actually the nostrils were a bit narrowed. The dog was born with it, unfortunately, and it's a very common problem in flat-faced dogs. So breeds like Shih Tzus, Bulldogs, Pugs, when they are flat-faced, the skull is sort of compressed and the skull is shorter. The airways becomes narrower, so the air can't go in really well.
Due to COVID, pet owners are not allowed in the clinic, so owners Nicole and Sarah nervously wait outside for the diagnosis, done through teleconferencing.
So the purpose of today, right, we are going to do a little bit of a reconstruction to open up the airway so that the dog can breathe a bit better. So there's a very high chance also that the soft palate is long, but we will examine it. But if it's severely elongated, if it's severely long, then we will have to do something.
The soft palate is the muscular part of the roof of a dog's mouth. It sits behind the hard palate at the back of the mouth.
This soft palate, instead of ending at this point, ends here instead. When this thing is overhanging like that, whenever the dog breathes, this thing will flutter because it's soft, right? It's like a flap, it will flutter. They pant to get rid of the heat, right? So airway go in and out, and this flutters even more, and this will temporarily swell up and become bigger, and then the airways become even smaller now. Over time, they have to suck in air so tightly, so hard, with so much negative pressure, the airway will collapse. There is a possibility the dog might die, but say for example, an owner who is not very aware and they bring the dog out in the hot sun and run around, they can't eliminate their heat and they are prone to getting heat stroke. Yeah, it can be fatal. My recommendation is, yes, the nostrils needs to be done, that's for sure. This part I will have to assess later on. Okay, but I would not want to do it if it's not necessary, because doing the back of the throat always has risk.
Yeah, just petrified right now because it's not like the leg or the hands, it's the nasal. So it's very important, and then if it is going to get complications, so hopefully...
We hope he don't have to stay longer, yeah.
I hope he's able to breathe better. Because he's a very special baby. So let's see how he goes.
It has been a week since Reeza was given up, and there has been some good news for the 7-year-old Pomeranian. She has found a fosterer. Desiree is homing Reeza until someone else adopts her permanently.
We have a buddy from VFA, and one day she just texted us some photos of Reeza and she explained to us the situation. So that's how we got to know her and ended up fostering her. We hope that she pulls through because there are 2 really big surgeries and we are looking forward to seeing her well after the surgery.
A successful surgery today will greatly improve Reeza's chances of finding a forever home.
So today we're doing surgery for Reeza. Most important thing that we want to do is getting her sterilized and at the same time fix up that inguinal hernia. It's definitely a 2-in-1. If I could just clear it up all for her, she's gonna feel a lot nicer. That's just the first ovary that we're getting out.
It's an hour-long operation.
So the first part of the surgery done, which is to remove the reproductive organs, the ovaries, and then the uterine horns, and then the uterus body.
Dr. Lee takes advantage of the current sterilization site to access and retract the intestines from the hernia.
So all that loops of intestines previously was actually just in that hernia sac. We've actually managed to just reduce everything back in there already, so you could see it's nice and flat now.
Reeza's intestines have been retracted back into the abdominal cavity, but they will herniate out again unless the tear in her muscle wall is fixed.
So this is just the sac, literally the bag where the hernia contents was sitting. We're pretty much at the last layer of closure from the hernia repair. So just putting in the last layer of suture to close up the skin.
At this point, Reeza has been under anesthesia for almost an hour.
The biggest risk with most surgeries is the general anesthesia.
With any amount of sedation, it does reduces their blood pressure. It still always puts a bit of a stress on the entire body system. And as much as possible, we're really trying to keep sedation to the bare minimum. Okay, so done. I'm just waiting for her to wake up fully for me to be completely happy, I guess.
While some pet owners give up their pets, others want them to live forever.
So you need to leave here with the
Tissue sample.
Yeah.
At the very latest talk.
So I need to get things started now.
Yeah.
At the Animal Wellness Center, Dr. Lai is scheduled for a very unconventional skin biopsy procedure.
I need to do it now because they need to be off ASAP within the hour.
You ready, baby? It's gonna be okay. Don't be scared.
So if need be,
Wou Wou is a 2-year and 3-month-old English Bulldog who's very healthy. She's definitely the princess, and we do call her the princess. I'm just making sure that the princess is not lost.
DNA is being harvested from Wou Wou so she can be cloned. This way, when Wou Wou passes on in the future, her owner Shri can recreate her from this DNA.
I'm just putting a bit of local anesthetic. We've given it a dose of tobugesic, which is actually a painkiller, but the side effect is it provides a little bit of sedation. It's a beautiful patient, I tell you. She's so good. It's a really nice dog. And that's one of the reasons why the owners want to clone them. You get 1 in a million. You get a dog that is so fantastic. So what people do is they take the skin for the sample and they put it into deep freeze until a time comes when they want to resurrect it. Okay, everybody, keep quiet for a while. Not too much noise, thank you.
The process starts with a simple but delicate procedure, a skin biopsy, where Dr. Lai will harvest samples of Wou Wou's DNA.
So I'm taking the first sample. Open up a bottle, please. Abdomen number 1 coming. This is called a punch biopsy. It takes out a circular bit of skin. They can freeze it for up to 10 years.
The actual cloning is not done in Singapore. Instead, the harvested cells will be sent to a lab overseas.
There are 3 countries doing dog cloning now. Originally, it was just South Korea. Now it's China and the US. It causes very little harm to the patient. Nature is remarkable. The skin cell contains information for liver, spleen, heart, lungs, brain. Given the right environment, it will develop into a new dog. Exactly the same, carbon copy. The most important part of cloning is you don't harm the dog that you're taking the tissue samples from, and you don't harm the tissues. And it has to be completely sterile. You cannot have any contamination. So our preparation is as though we're doing a surgery. Can we have a spray for this, please? Dog cloning has been very successful for the last 15 years. It's not new, and these clones live a normal life. We don't have a lot of requests because the price at the moment is still prohibitive. So the actual cloning cost is approximately between 50 to 100,000 USD.
In the last 8 years, Dr. Lai has collected the DNA from half a dozen pets, but so far, only one owner has proceeded to the cloning stage, Dr. Lai himself.
I cloned Khan, my dog. He's a kennel dog, very special to me. He had a brain tumor. He was 17 and a half. I took some cells from him because I knew his time was coming. I sent it to China. It's 50,000 US for a clone. And there are no guarantees.
Here's how cloning works. Wou Wou's DNA will be used to replace the DNA of a surrogate's ova or egg cells. The egg cells are then transplanted back into the surrogate dog. A puppy reproduced with these eggs will be a clone of Wou Wou.
All right, all done.
Cloning is controversial, with concerns that cloned animals could have poor health. But for owners like Sri, this is the only way to have their pet around forever.
Yeah, having a dog is like having a child, but then you know that their lifespan is not going to outlive yours in a way. It's nice to just have that at the back of your mind, like, oh, I would have the option to clone her.
She's in pretty good health. I don't think humans should be cloned, but I don't see the problem in cloning companion animals. We tell them the pros and cons, and the owners make the choice.
At the Advanced Vet Care Veterinary Center, Asha the Shih Tzu-Bulldog mix is about to get a nose job.
We're going to move into the surgery. Opening of the nose, right, it's a bit narrowed. Can you even see that it's actually closed? So the idea is we're going to make some incisions over here, cut it, and then try to wedge it open so that it's nice and wide like this.
As surgery gets underway, the issue of Asha's soft palate is the first thing on the agenda. If it requires shortening, recovery will be more complicated.
Okay, so we're gonna assess the soft palate. We're gonna have a look at the back of the throat. It's actually not too bad. So we checked the soft palate, and it was just very mild, and it didn't require any procedure. So I'm not too worried about this. I'll just take a picture for the owners later. So now what we're gonna do is we are going to cut that small little wedge of tissues from the nose to try to open up the airways. I need a bipolar cable. Today's surgery is not something that is very major, but it was a very delicate one because the dog nostril is very tiny. Everything is just scaled down because one you miss it a little bit, everything just goes out, and there's no recovery from that. You can't reverse a drill hole. So it can be very tricky. I think it comes with its stress. Okay. You can see it's definitely wider than what it was originally. This is after. The challenge is to get the nostril symmetrically sized. I often run through the procedure in my mind all the time. So before even the surgery happens, I would have sort of done it a few times in my head. So that's how I work. So putting the last 2 stitches in. Okay. I'm pretty happy about it. So we're just gonna wake little Asher up and see how he does after the operation. And hopefully he makes a good recovery without any complications. Yeah, it's Dr. Nick again. It's about Asher the boy. Everything went well for Asher. We managed to do the surgery. Unfortunately, we didn't have to do the soft palate. Should be ready to go home around about 6:30.
Okay, I'll be there.
Okay?
No problem.
Alright, I'll see you. Take care.
Thank you, doctor.
No worries.
Thank you.
Bye-bye.
At Gentle Oak Veterinary Clinic, Reeza, the rescued Pomeranian, is ready to be picked up by her fosterer, Desiree.
For Reeza.
Reeza is expected to make a full recovery within 10 days, once her surgical wounds heal.
The sutures are all dissolvable.
Okay.
As long as she does not lick at them, you'll be fine.
Yeah.
Okay? All went well, nice and smooth. Alright, she's very, very brave.
So Reeza's a really, really sweet dog. She never once put up a fight with us. She was just so cooperative. And she's a very, very stoic little character. And yeah, and she never kicked up a fuss ever. She's just a sweetheart, actually.
She's got a home already?
No, I don't know. We've had her for a week.
You're gonna keep her for good? Cannot let go, huh?
We are really glad that she pulled through the entire thing. Unfortunately, I can't adopt Reeza because I have a dog who has quite high needs at this point in time. But I definitely hope that Reeza finds a good home because she's a really sweet girl.
Okay? Alright, good girl. So I think all is okay. Nothing too much to worry from here on, huh? So now, just need to find your forever home.
Yes.
Good boy.
You are very sweet. What to do?
Oh, so scary, don't shiver. In the past, maybe 30, 40 years ago, dogs, cats, and pets are just considered an animal. I think nowadays, they are considered a big part of the family.
You are so good. They share the same dining table, they share the same bed, they share the same shampoos for the vet. That is a real stress because you're not dealing with another dog or a cat, you're dealing with their child.
Nice and comfy. Sometimes when we end up building a long relationship with our patients, we do genuinely look at them as almost like our foster pets. And when it comes the day where there is absolutely nothing in your power that you can do to help, it breaks your heart as well. It takes a part of you.
Okay, good boy.
In the next episode of At the Vets,
The chemotherapy doesn't quite work on him.
a last chance surgery for Mingyu.
So we are willing to try alternative treatments for Mingyu's cancer.
A final goodbye for Junior.
Is having to put an animal down easy? Answer is no.
And a late night emergency at the clinic.
Excuse? Just...